I transitioned to an out-of-network, personalized orthopedic model, and it completely changed the way I practice and the way that I live. Why would you consider going out of network? For many of us, the answer starts with frustration. If you're practicing in network right now, you probably know the feeling. You're seeing 35 to 50 patients a day, spending 7 to 10 minutes per visit, and trying to squeeze meaningful care into a schedule that barely gives you time to chart, let alone connect. You might feel like you're constantly checking boxes for the sake of documentation, not because it actually improves any outcomes. When it comes to a treatment plan, you're often at the mercy of insurance protocols that don't reflect your clinical judgment or your patient's actual needs. Today, we're talking about something that impacts every patient and physician out there: the decision between in-network and out-of-network medical care. Patients often wonder, does it matter if my doctor is in-network or out-of-network? Doctors, meanwhile, ask themselves, should I consider moving my practice out-of-network? Today, we'll explore both sides clearly and thoroughly. Let's start by clarifying the terms. In-network care means a physician or clinic has a contractual agreement with an insurance company. This contract usually specifies the rates the doctor can charge and the procedures they'll cover. For patients, this typically means lower upfront costs and predictable copays. Out-of-network care, however, involves doctors who intentionally choose not to contract with insurance companies. They set their own fees and practice independently. Patients often pay upfront and can later seek reimbursement from their insurance. This model can initially feel intimidating, but there's often greater flexibility and higher quality interaction in these settings. Finally, there's a hybrid approach where some services are provided under insurance contracts, while others remain out of network. This hybrid can offer the best of both worlds for some physicians and patients. As an example, in my own practice as an out-of-network concierge orthopedic surgeon, I've been able to spend significantly more time with each patient than I ever could when I was in-network. Instead of rushing through 10-minute appointments, I can dedicate 30, 45, even 60 minutes to understanding the full context of a patient's pain, goals, and lifestyle. That time allows me to not only make better decisions clinically, but to build a real relationship with the person in front of me. Patients consistently tell me that they feel seen, heard, and guided through the process, not just processed through a big box system. And from a professional standpoint, I feel more fulfilled practicing medicine in this way. I get to focus on outcomes, not just volume. Now, if you're wondering what the actual experience is like as a patient in each model, let me paint this picture for you. In-network care often means shorter visits. Think 10 to 15 minutes with your doctor, sometimes less. Because these practices usually run on volume, it can also mean longer wait times just to get an appointment. Once you're in, the conversation might feel rushed with limited time to really dive deep into your concerns. And depending on your condition, there can be hurdles like insurance pre-authorizations or restrictions on certain tests or treatments. Now, contrast this with the out-of-network model. In an out-of-network practice, appointments typically run much longer, often 30 to 60 minutes. You usually get in sooner, and once you're there, you're not just rushed through. The conversation is more thorough, more personalized, and more patient-centered. Your doctor has the time to really understand what's going on and explain all of your options. They also have greater flexibility to order the tests or treatments you need without waiting for insurance to give the green light. And because that care is more personalized and proactive, the outcomes sometimes speak for themselves. So why would you consider going out of network? For many of us, the answer starts with frustration. If you're practicing in network right now, you probably know the feeling. You're seeing 35 to 50 patients a day, spending 7 to 10 minutes per visit, and trying to squeeze meaningful care into a schedule that barely gives you time to chart, let alone connect. You might feel like you're constantly checking boxes for the sake of documentation, not because it actually improves any outcomes. And when it comes to a treatment plan, you're often at the mercy of insurance protocols that don't reflect your clinical judgment or your patient's actual needs. I have been there many times. When I was working in an in-network system, I knew I wasn't practicing at the top of my training. I couldn't spend the time I wanted with my patients. I'd make a recommendation only to have to navigate prior authorizations or denials. And worst of all, I saw the impact on my patients. They were frustrated, confused, and sometimes getting worse while waiting for those approvals. Eventually, I decided this isn't the kind of physician I set out to be. So I stepped out of the system. I transitioned to an out-of-network, personalized orthopedic model, and it completely changed the way I practice and the way that I live. In my practice now, I spend 30, 45, sometimes even 60 minutes with the patients. We don't just talk about the joint that's hurting, we talk about their goals, their lifestyle, their fears, their timelines. I can order any imaging I need when I need it. I can refer to physical therapists I trust without having to work around arbitrary network restrictions, and I'm not pressured to rush through visits just to keep my doors open. The result is so apparent: better care, better outcomes, and much less burnout for both me and my staff. But let's be real. Going out of network isn't always easy. It requires systems, it requires clarity, and it requires the courage to explain your value to patients who are used to an insurance-based care. But it's also one of the most powerful ways to reclaim your autonomy as a physician. You get to practice medicine the way you were trained to, with time, intention, and compassion. And just as importantly, you get to design a practice that supports your life, your family, and your longevity in this field. Because this isn't just about what's sustainable for the system, it's about what's sustainable for you. So if you're feeling that tug, that quiet voice saying, there's got to be another way, just know you're not alone and you're not crazy for wanting something better. So for patients, let's talk openly about the financial side, because we know it's a huge factor in this decision. Yes, out-of-network care can come with higher upfront costs. That part is true. But let's look beyond the sticker price and talk about the value. When you're paying out of pocket, you're not just paying for a longer appointment. You're paying for a more thoughtful experience. You're getting a physician who isn't rushing through a crowded schedule, who can actually listen, dig into the root of your problem, and create a personalized plan that may help you avoid unnecessary imaging, repeated visits, or even a surgery. And in many cases, out-of-network doesn't mean uncovered. If you have a PPO plan, which many people do, your insurance will often reimburse a portion of your visit. Most out-of-network practices provide something called a super bill, which is a detailed invoice with all of the necessary codes for you to submit to your insurance. Depending on your deductible and benefits, you could receive anywhere from 30 to 80% back. You can also use your health savings accounts, HSAs, or flexible spending accounts, FSAs, which are tax advantaged to pay for these services. That alone can reduce your effective out-of-pocket costs by 20 to 30%. Recent data shows that hospital prices negotiated by private insurance plans are often higher than the standard cash price available to uninsured patients. In one Health Affairs analysis, nearly half of the services looked at had lower cash prices than negotiated insurer rates at the same facility. This is a systemic issue known as cost shifting, where insured patients indirectly subsidize care for those on Medicare or Medicaid, while uninsured patients sometimes receive discounted prices. This reality highlights a troubling truth. Having insurance doesn't always equal paying less. Sometimes it means entering a negotiating system that inflates costs. Thanks to federal transparency policies, the Hospital Price Transparency Rule, and the No Surprises Act, patients must now be given cash price estimates upon request or when booking care, and hospitals must publicly post pricing for 300 common services. That means you can shop smarter and sometimes better off paying cash or going out of network if your insurance reimbursement is inefficient. And here's something else to think about. How much are you already spending in time, energy, and frustration trying to get answers in the traditional system? How many visits does it take to finally get a diagnosis? How much work do you miss because your pain isn't managed properly? Sometimes investing in high-quality care upfront actually saves you more in the long run. Not just financially, but in terms of your quality of life. Ultimately, out-of-network care is about access, efficiency, and outcomes. And for many patients, it's worth every penny. So if you're a patient who's curious about whether out-of-network care might be right for you, here are a few things to think through. First, take a closer look at your insurance plan. A lot of people don't realize their policy may include out-of-network benefits, especially if it's a PPO. That means a portion of your care could still be reimbursed. You just need to understand what percentage, what your deductible is, and what documentation you'll need to submit. Next, ask about the costs up front. A good out-of-network practice should be fully transparent about fees. what's included, and whether you can use tools like health savings account, HSAs, or flexible spending accounts, FSAs, to offset your out-of-pocket expenses. And here's the real question. How do you feel in your current care experience? Do you feel like you're just another number in a crowded waiting room? Are you constantly being rushed through appointments or struggling to get clear answers about your health? If so, it might be worth finding an out-of-network provider that gives you more time, more access, and more thoughtful care. Ultimately, this is about your priorities. If you value more in-depth discussions, a physician who really knows your story, and the ability to explore all of your options without insurance roadblocks, then out-of-network care might not just be worth it, it might be the kind of care you've always wanted but never thought was possible. Now, for physicians considering going out-of-network, let's talk strategy. Start by assessing your patient population. Would your ideal patients value more access to you? Would they be willing to pay a bit more for deeper care, longer visits, and fewer hoops to jump through? In many cases, especially in specialties like orthopedics, dermatology, psychiatry, or women's health, the answer is yes. But you need to be clear about who you serve and what they're looking for. Second, get your pricing right and get it clear. Patients are willing to pay out of pocket when the pricing feels fair, predictable, transparent, and easy to understand. Avoid vague or piecemeal costs. Instead, create bundled rates or transparent packages that reflect your value while respecting their budget. You'll also want to make the reimbursement process patient-friendly. Even if you're not billing insurance yourself, you should offer support, whether that's providing timely super bills, pointing patients to claims submission apps, or just walking them through what to expect from their insurer. Educating your patients is key. Your front desk or care coordinator should be able to explain what it means to be out of network, how HSAs and FSAs work, and why this model benefits them in the long run. And if you haven't already, build communication materials, emails, PDFs, or a simple FAQ page that walk patients through these points clearly and compassionately. And finally, remember this shift is more than a billing change. It's a philosophical one. You're reclaiming your autonomy, you're deepening your patient relationships, and you're protecting your time and energy so you can continue practicing medicine in a way that is sustainable. Yes, it takes planning. Yes, it requires mind shifts, but most physicians who go out of network say the same thing. I finally feel like a physician again. Whether you're a patient navigating healthcare choices or a doctor considering new practice model, the decision to pursue in-network or out-of-network care is significant. And at its heart, this conversation is about the kind of healthcare experience you want to give or receive. In future episodes, we'll continue exploring how to make healthcare choices that truly support resilience and long-term wellness. I can speak from my personal experience in my practice that it has been a game changer for not just myself, but also my staff. My staff is not bogged down by doing a bunch of pre-auths and appeals and resending super bills to the insurance companies. They have time to talk to my patients and really give them that personalized care. And the biggest hurdle has been explaining what out-of-network means to patients. They often hear the word out-of-network, they hang up the phone. They don't even want to hear what that means. My prices are super transparent. I'm like a hair salon. I have a list of prices of what a consultation costs, what an x-ray costs, what an injection costs. And I've made those prices super reasonable. And just the other day, I realized I haven't even changed my prices in 10 years. That's almost unheard of in any other industry. Usually, every year you go get your hair cut and dyed, that price is going to go up because your hairstylist has higher rent. The cost of supplies is increased. And in my practice, I'm able to keep my overhead a little bit lower because I'm not spending all that time and energy and staff on trying to figure out what the insurance needs or wants from me. Thank you for tuning in to The Resilience Factor. If you're ready to build a stronger, longer-lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.